Good afternoon. My question is for Dr. Makanyengo regarding the spirituality and mental health. So, the first issue I noted, or rather I have a question with, is Trezorix has cyproheptadine. So you're giving Trezorix with the olanzapine. So is it that the olanzapine was not working in the first place? That's the first question. The second question regarding still on the olanzapine, the dose was at 2.5 milligrams. These symptoms to start rapidly and disappear rapidly, could it also be something else other than these demons waking up and being kicked out of the body? Those are my two questions.
I'm saying my name is Amon Otieno, and I just want to start by congratulating the presenters. And this has been a very powerful session after lunch. My question goes to Dr. Makanyengo. You have presented well very powerful and strong collaboration between science and spirituality. However, we all know what is going on currently in our country. There are two sides. What you presented is just one side of collaboration between spirituality and science. We know that there's a different side which is quite extreme, like the Shakahola bit, that doesn't, the do not appreciate spiritual intervention, while the spirit also don't appreciate medicine. So in a case like this, what would you recommend for future or even current cases that look like Emma in this particular case? How can you go about it in making in order to get a patient to be assisted? Thank you.
This one goes to Dr. Makanyengo. Very interesting presentation. The first thing, there are a few things I noted in the presentation. The first thing is that you mentioned that there was only family history of alcohol use disorder. Yet, that was not the biological father. So we don't know anything about the biological father. So he could be schizophrenic. They could have seizures in that family. So it's not clear about the family history. That's the first thing. The second thing I noted is that it began when she was, I think, in class 3. She must have been 9 years old. I think the ritual had not been done. Most probably it was done in high school. I'm not sure. I don't think in primary they drew the triangle and they started chanting. That's number 2. Number 3, just to mention a few things, the EEG was normal. What is the rate of positive EEGs? That is the number 3. Then I'd like to just highlight a few other things. Passivity phenomenon, when she was feeling like she's being controlled. That is passivity phenomenon. And then ideas of reference. When there was some connotation about her showering. If she showers, this will happen. That's an idea of reference. Then again, talking to a different world and being tortured in this different world. This is autism. It's like they are connecting to a different world. Exact. Yes. In fact, I can see someone wants to say more. And then the voices on and off, and the halos that were around people's heads, and I think around people's bodies. So then we just gave Tegretol. That is my concern. And if you look at what the International Bureau of Epilepsy and International League Against Epilepsy recommends, is that you do trials of medications You don't rush. And it could actually be that this child might have been in ictal events. That is what might have explained what was happening. But it could also be spirituality. We don't know. I just wanted to shed some scientific light on it. So, thank you.
Okay, thank you, Dr. Kinyanjui. So, any other question, please?
We've even been promoting, there was a time there was a committee for investigating devil worshipping in school in the 21st century. And this kind of following is the one that puts children in this situation. The power of suggestions, even coming from families, from homes, from different religions. We've just seen it in Shakahola. And the people presenting with unusual symptoms because things are being suggested to them. And the question to ask ourselves now is, what is our role as health providers, as scientists in such situations? That's just a comment, it's really not a question.
Okay, any other person to ask question?
Mine would be to ask, would there be any role for, like, for example, monitoring one's mood, just like we're able to monitor our footsteps, the way we're able to monitor the heart rate, the way we're able to use these devices to help us meditate? Is there any way we can also encourage people to use the wearable devices to promote mental wellness? I hope I'm clear. Thank you.
Okay, thank you. So, any other question?
About spirituality and mental health. It's really a concern to us as the clergy. And I also want to commend you by saying that it is good that you have told us to really know how to differentiate, how to be able to know, and when it is spiritual, and to differentiate when it is spiritual and when it is just mental and we can handle in the hospital. I want to also ask Alfine or Aflin. She talked about the elderly, and I also want to thank you for speaking about that. And I have just one question in that regard. You've talked about the elderly and their spirituality and how migration is affecting them. I don't know whether you've handled the mental part of any research on widows or something like that. Maybe you can highlight on that.
I will give the final question.
I also thank all the presenters for very insightful presentations. I have only one question for Dr. Makanyengo. If we are to follow the very useful emphatic recommendation about thinking about spirituality, when do you make a decision that this, like as you did in this case, that this is now a spiritual problem that requires a spiritual healer and not something that would respond to conventional care? Is it when the symptomatology of the patient includes religious symbols and content, or is there another explanation? And I ask this because from the perspective of the spiritual people, almost anything psychological can be classified as being spiritual. So do we say if somebody is hallucinating, has delusions, has depressive symptoms, they should go to a spiritual healer because these are spiritual symptoms? Or do we only restrict ourselves to those that have content that is religious or spiritual? Thank you.
But I think it's a very important thing that we should really get to dig into. Yeah, so I think it's a very, something that we need to look into, but it's not yet done yet. Yeah.
The things that we are looking into is to be able to create a model that is able to predict people who are at risk of a major depressive episode or mood disorders or anxiety. So one of the things that we can do with these wearable devices is to be able to pick indicators that are related to our mental well-being. So for example, if we look at something like sleep, when you look at sleep, the activity rate, when let's say when somebody is very lethargic, or at times when somebody is really hyper, is this something that speaks in terms of a person's mental well-being? When it comes to sleep, is somebody experiencing insomnia? Are they not sleeping? And then when it comes to the issue around heart variabilities. So in terms of the wearable technology, it's ideal around picking certain indicators that can be able to relate to mental wellness. So it's more around picking indicators, but we cannot have like maybe the device itself creating some sort of prompt that probably you need to seek help, but rather to be able to sensitize people in terms of what are some of the things that you can look out for. If let's say you look at your activities, if you look at your sleep patterns, is it speaking anything in relation to your mental well-being? Thank you.
Matter, but it's something I believe we cannot ignore, because now, for the fact that even the government at one time had to start investigating these allegations, shows something wrong is happening somewhere. So there's a question about that appetizer, the Tresoris, we did not use it for long, but that olanzapine did not help her. She was actually getting worse. 2.5 is a low dose, but I know patients who on higher dose than that, they just don't tolerate it. They are so sedated, and she was not getting worse. She was not getting well with that olanzapine. Yeah, the Tresoris she did not use for long because she then started eating well, but her condition was not getting better. Now, somebody asked about Shakahola and a lot of questions about spirituality and how do we handle as mental health workers. Yeah, Shakahola is unfortunate. Shakahola is a situation where you found there's a leader who is very, what is it? Somebody who what do you call it? When you have charisma, who actually lure people to the wrong things. We have some leaders who have, historically, there's been Hitler, there's been Mao Zedong, there's been this Jones in Guyana, and several such leaders, and even local and even in Africa, who have this ability to get people on their side to do things. And that is a charisma they have that perhaps they are born with it, I don't know. But just like, unfortunately, some of them have come into the church and they could be masquerading as priests or as church leaders, and then therefore giving a bad impression. We were discussing it over lunchtime. We were saying such leaders, probably they have some kind of a mental condition, but so as their followers. I think studies have shown that a lot of the people who follow cults have some kind of conditions. They have some kind of insecurities, low self-esteem, and they feel worthless in life, and they feel like they've reached the end, and they need someone, just one small thing, and then they start following that person. So that Shakahola example should not be made to feel that all religion is bad and evil, It's just unfortunate. Just like you can have doctors who are pretending to be doctors, or doctors who are doing wrong things. It just happens to be the case. But I believe as healthcare workers, we need to be aware of spirituality aspect. We need to practice patient-centered care, where we look at the person as a whole, look at what their beliefs are, look at the sources of their conditions are, why are they where they are. Perhaps that they went through certain situations or the upbringing. Let us not ignore and just focus on just the clinical aspect. Yes, you don't have these signs, but then this person developed this after leaving the church that she used to go to, or the prayer that she used to do. We cannot ignore that. So as ourselves, we need to be open-minded, get holistic, biopsychosocial, and now spiritual evaluation of our patients, so that when we are doing an intervention, it is holistic. So that we are aware that, look, this I'm giving the right medication, but I think she needs a psychotherapist, or I think she needs an occupational therapist, or I think she needs a chaplain, yeah? Because there's something, and the truth is, the spiritual intervention and studies are there have shown to have a marked improvement on mental health among other forms of health, yeah? Now, the mother is the one who had history of mental illness, the biological mother. I don't know, I didn't hear you well, but I think you were saying that is that you couldn't understand which parent. The father she was staying with was not the biological father, it's the mother who had history. Now, what I'm saying, I'm not ruling out the fact that there could be a mental condition there as well. Yeah? It's possible that with that family history of alcoholism in the mother and all those generational issues on the mother's side, there could be some psychopathology. Yeah? But what we are saying is that that's why we talk of holistic care. Yeah? So EEG is about 30%. I think 20 to 30% sensitive. But nevertheless, you still want to do it because we have received some EEG results that actually show something. But there are some of the basic tests we require to do. You mentioned about this list of other ideas of reference, actually symptoms that you'll find in schizophrenia and other conditions. We don't rule them out. This presentation was not to come and rule out and say, all this was just demons. No, no, no. It's just that we need, even when we are doing our evaluation, let's take our history, look at it holistically, and plan an intervention that is also holistic and get results. The fact that this girl is 2 years down the line, not on any neuroleptic, maybe we need more cases, so that we can have more cases and say, oh, these 50 patients benefited. I don't know, but that's why it's a case study. And the case study is teaching us, let's have a holistic mind. Let's not belittle something, maybe because maybe in ourselves we may not believe it, but patient-centered care says, let's try to look at care from the eyes of the patient and see what makes them happy. If praying is going to make this person happy, by no means you may not be praying yourself, but then get someone to pray for the patient, and that's the holistic care we're talking about. The one that was there ever in ancient times, and we are going back to it, including our top universities, So that's all I'm really talking about. And I don't know if there's one question. Okay, Dr. Atwoli, you talked about manifestation. That is very interesting. And that's what we have done. We've come up with a protocol. I've developed a protocol based on the work we have been doing that to guide anyone who is coming in as a chaplaincy who would want to do spiritual therapy. This is how you need to start. You have to work with the team. You have to liaise with the doctor. But my experience is that some patients manifest in very strange ways. First of all, the history. Studies have shown, and that's research, that people involved in occultic practices and this kind of actually are likely, and the references are there, to develop mental health conditions. Yeah, so just first of all, even just the history of exposure. Then after the history of exposure, you want to look at, evaluate the patient and see. Like personally, there are patients who I've seen who will manifest in bizarre ways. Bizarre, I mean really bizarre, that you see, this, it looks like me, even if I tried practicing it so many times, it may not work on me, So you will have to look at the history, you look at the manifestation, you will have to look at the content, like the content of some of the things she talks about are some of the contents which, if you read about, what do we call this? Some of these seances or these ceremonies that are done by some of these things, these are some of the things that are practiced. So you listen to the content, yeah? And then last but not least, you need to have some discernment. And it's tricky. How do you train one to have a discernment? But me and this Muslim psychiatrist, that day, honestly, we looked at each other and we had a discernment that something is not right here. I'm not saying I'm better than you, Doc. I don't know. I don't know. But it's something in your heart that says, this one, he's kawaida. So it's hard to, that's why I'm telling you people, it's not an easy case. But let's be aware. Let's work with teams and let's work to actually be the leaders. I want it to be that University of Nairobi or Aga Khan University is leading in research it shouldn't be that we're following royal psychiatrists, because these people already are acknowledging there's something. So I'm challenging you all, let's not shut out something when I believe there's something here. Thank you so much.